Have a caller looking to get in touch with us, but I've got to remind you we have a guest in the studio, and as they used to say on Monty Python, and now for something completely different. Uh, Better Health with Tripp Family Medicine, which I mentioned twice was coming up in this half hour of the program. So just a quick note there for all of you. Hold the telephone calls. Bill Colley with you on Top Story on News Radio 1310 KLIX and newsradio1310.com. And we're at 26. Not going to be terribly warm today and probably cloudy. And as I said, we're looking forward to maybe some snow and a mix of rain and snow even on Saturday before things get really, really nice beginning of next week. But in the meantime, Jeremy Daly joining us this morning. He's a physician assistant at Tripp Family Medicine. He is in the rotation. I think that it's like a starting rotation. You guys remind me a little bit of the Baltimore Orioles when I was a kid, when they'd have 420-game winners in the rotation every year.
Yeah.
That was a pretty impressive feat. But it's good to have you come back. And this time of year, we talk a lot about various viruses that move quickly because people are in confined spaces.
Sure.
And we're talking about something today that has a couple of different names. It's got a scientific name, and then it's got a name that's a little bit better known as among the public.
Yeah. So the scientific name that we know it as it's Bordetella pertussis. Okay, and it's a bacterial.
That's a mouthful.
It is a mouthful, isn't it? And it's a bacterial infection. Kind of the colloquial term for this is whooping cough, and that's how it has been known mostly as whooping cough, and it's known for that name because of the very distinct sound that people make when they get this infection. Kind of the end of the cough, just a high pitched whoop that we hear at the end of that, and something that we saw a lot, 50 to 100 years ago, it was pretty prominent infection, and as soon as we have developed some vaccines for it, we saw that there was a drastic decline. However, because of many circumstances, some of which have to do with decreased amounts of vaccination that are done, we've seen a marked rise in the amounts of pertussis.
I think that a lot of it, too, though, is there was that period, at least when I was a kid, where you didn't even hear about it very often. And so it was a period that maybe went on for a long time, and people tend to forget a lot of these old diseases. And then suddenly they make a comeback. And I was sharing off air that I grew up in a community where we had about 3,000 people, but 1,000 of them came from an Amish community, and many of them had objections to the vaccination. So there would be outbreaks at least within their community, and although you didn't share a school with them, you shared a grocery store with them and the bank with them, and so sometimes those outbreaks would then spread beyond there. It started to become especially common again in the 1990s, it seemed, after having been away for a long time.
Yeah, and that's kind of the course of it. And when I first started practicing in Texas, the rates were pretty low, less than 1,000. 2011, and then in 2013 there was a pretty marked increase. It was about 4,000 cases of whooping cough were diagnosed that year. Now, I mean, there's a lot of reasons why those things happen. I mean, sometimes it's kind of a cyclical thing where, if you look historically, there does seem to be and I don't know if it has to do with awareness and disease transmission, just having to do with people vaccinating more, and then they kind of forget, 3-4 years down the road, and then they'll have another major outbreak and so on and so forth, or if that's just the cycle of the disease. But it seems to rear its head every few years, every 3 to 4 years, especially looking back at the last, and this was in Texas, I was looking at some statistics, it was about the last 20 years. Every 3 to 4 years, we'd see a pretty big increase in pertussis.
It also, from what I recall reading about it, I would see stories about outbreaks on the AP wire. Seem to happen more in rural communities than in urban communities. Is there a reason for that, or is it just maybe some sort of? I noticed it maybe more in a rural community.
That's a good reason. I was thinking about one of the big outbreaks that I saw. I did some of my training in a community called Crane, Texas, and it's south of a smaller city, Odessa, Texas, and that's where one of the bigger outbreaks was when I was doing my training. And rural community. Recently, we've had a few cases in the Magic Valley, Buell, Filer, Kimberly have all had cases of whooping cough recently. I haven't read any reports of cases in Twin Falls, so yeah, that kind of fits with your theory. But as to why that happens, that's a good question.
Now, we're not looking to engage anyone in any debates about vaccines today, but there was a story on the AP Wire today that the legislature has forwarded a bill on from committee that will make it easier for people to opt out if they choose to. So we're not making a judgment on that, but we're just saying that could possibly increase this at some point.
Yeah, and I think a lot of people that are conscientious about their health, they see these trends. There seems to be certain vaccines that people have an aversion to.
Sure.
And some of those have to do with the studies that have been done in the past, some of which haven't been verified. Um, but there's a lot of good reasons to vaccinate, and we'll talk about those here in a minute.
All right. I want to thank Jeremy Daly for his input. He's got more of that on the way in a few minutes. Better Health with Tripp Family Medicine. Remember, life's too short not to feel good. That's why they join us on Wednesday mornings between 8:30 and 9 o'clock. It's 20 minutes from 9. It's 28. Bill Colley with you, too, on Top Story on News Radio 1310 KLIX. Jeremy Daly is a physician assistant, and he's joining us from Tripp Family Medicine this morning here in Twin Falls, located on Fillmore Street, directly across from the main post office. That's on the north side of the city. I want to remind you the office is still looking for new patients, and as a patient of Dr. Tripp's office, often they can see you on the very same day if you called early in the morning with a pretty serious medical issue. If not within 24 hours, often we stress because what I may think is a serious medical issue may not necessarily rise to that, and there's some other factors that go in there too as well.
Sure. And we have great nurses that work there that have enough know-how to, and if they don't know the answer, they come and find us. But there's cases where people call and we feel like, based on the schedule that we have that day, maybe they can be pushed to the next day. But we really do try to get people in the same day if we can.
I just remember when I was a kid, and I had a friend named Jim Clark, and Jim missed a lot of school, and I didn't. So I was over at Jimmy's house visiting, and his mother says to me, she said, "I understand you make school just about every day." And I said, "Yep." And she said, "Jimmy gets a hangnail, he doesn't want to go." So you have to break this down, obviously, when people call in and understand that, make a determination on whether they're in some sort of medical distress at that point.
Sure. Yeah, we want to make sure that we take care of our patients as best we can. And sometimes that means bringing people in the same day, and sometimes we don't have a schedule for people, or we kind of just work them in as the day happens. But we try to, if it's something that needs to be seen the same day, we do our best to get people in, because we don't want someone to have to go to the ER. If they're patients of ours, we like to take care of them. We like that continuity of care to be there. We know them and we care about them, and so we want to make sure that we get them in that same day.
Wanted to point out, we're talking about whooping cough this morning, and Jeremy, you were just in the middle of a point, and suddenly we went to break. I only wanted to pick that up, I guess, on this side of the break.
Yeah. Just one, why would we vaccinate for whooping cough? The obvious answer is prevent transmission of disease. We the main reason is whooping cough is extremely contagious. It really is. If you are diagnosed with whooping cough, you are contagious for 3 weeks. And then in terms of the other things that we look at as far as the disease, there's a 7 to 10 day incubation period. So let's say you're around someone, they're coughing, they have whooping cough, you breathe in these respiratory droplets, so this bacteria gets into the air, you breathe it in, you don't feel bad, sometimes for up to 10 days, and then you start to develop symptoms, and by the time 10 days has gone past, you probably forget that you were around somebody that had a bad cough, and maybe you remember that, but maybe you just happened to walk through the same air that they coughed in minutes earlier, and no other evidence of any sick person at that time.
Is the vaccine a once-in-a-lifetime issue, or do you have to get boosters now and then?
That's a great question. So, in childhood, we do it 2 months, 4 months, 6 months, 15 to 18 months, 4 to 6 years, and then we do a booster at 11 to 12. And then it's recommended to get about every 10 years after that. So we're giving it in conjunction with tetanus a lot of times. So It's a three-part vaccine. So in childhood, it's called DTaP. So diphtheria, something that we don't see very common at all anymore. Then we have your tetanus, and then something called acellular pertussis. So your whooping cough.
How long, when someone actually develops the symptoms, how long is it going to last?
It's a good question. So if it's treated, a lot of times we see that shorten quite a bit. If we're treating people, and there's an antibiotic called erythromycin, that's kind of the treatment of choice for whooping cough. If you're treated pretty early on, you're not contagious 5 days after treatment. Whereas if you are not treated, it's 3 weeks, like I said earlier. But but the duration of time for someone that's not treated, especially if they're not treated early on, is about 4 to 6 weeks. So you can have that terrible cough even after the point of being contagious and being at risk for transmitting the disease. You can still have a pretty terrible cough. So we're looking at a month and a half of this terrible cough.
But much more common, though, it seems, in children than it does in adults.
It's in terms of developing we worry about children and the elderly a lot more because of the rates of mortality, but we see it in all walks of life. Um, Definitely, the vaccines are a lot of times geared towards protecting the young and the old. I mean, and that's in general, right? With any type of vaccine, we're trying to protect those in the herd, so to speak, who are uh, weakest. And like I said, the first vaccine starts at 2 months. So if you are less than 2 months, you're at risk. You're not immunized at all against pertussis.
Wanted to mention Jeremy Daly is joining us in studio. We're talking about whooping cough, as it's generally known among the public, and the telephone number, if you have a comment or question for Jeremy from Tripp Family Medicine, it's 208-736-0300. And we have a caller joining us on air. Caller, you're up next.
Yes, sir. Good morning. I just tuned in. I hope I haven't already asking something that's already been answered. But as far as the flu epidemic, or whatever they're calling it now, is this because the vaccines are for a particular strain, and then a different strain starts to spread? Does that render the vaccine useless, or how does that work? I know I got my shot, but I'm not sure that does it protect me if it's a different strain that's spreading?
That's a great question, and yeah, it is all based on the strain of the flu, and the CDC, they try to extrapolate based on the strains that they see at the time they make the vaccine, and sometimes it's even based on what they can grow, um, but but a lot of times, if it's a strain that they don't that we don't have a vaccine against, it's not going to protect you. Yeah, that's exactly right. So it is one of those things that there is a lot of variability, and there's some guesswork. Um, Obviously scientific guesswork, but there's times like this year where it seems the vaccine's not as effective as we would hope it would be.
Thank you.
Yes.
Mentioning these types of things, too, you got to point out, though, that it's odds and probability. If you don't get it whatsoever, uh, your
Sure.
chances of probably getting sick go up. And even though some years it may not be as effective as others, you have at least some protection against some strain.
Yeah, exactly. Well, and the truth is, I mean, I've gotten the flu vaccine for years. Um, I've never been diagnosed with the flu. I'm around flu, especially during this time of the year, multiple times a day. So, some of it I think has to do with practicing good spread precaution. I wash my hands in and out of the room. Obviously, I'm not sharing food or drinks with anybody that's coming into the office. I don't do that anyway. But we're doing the things that would help us to prevent transmission. And if you have the flu, then you put yourself in a position to rest and to get better, and don't go to work. I mean, that's as simple as that, because you don't know who's got a baby at home. You don't know who has some sort of immunosuppressed issue, and whether it's disease or low counts of certain types of cells that would put them at risk for developing disease. So be responsible if you do get infections. I think that's another point to make.
We have another caller. Caller, you're up next. You're on the air on Better Health with Tripp Family Medicine.
Can you please talk about the diseases the illegal, unvaccinated children are bringing back into our country?
Well, I I can appreciate some of that. We definitely worry about the public health concerns of people coming from other countries unvaccinated, and I think in terms of getting people to the health department, we're able to take care of a lot of those diseases as far as getting vaccines. Um, and that may be part of a public health concern, but I think in terms of what I see on a regular basis in this area, there's a lot of people that decide not to vaccinate their children, and they're here in our country, and I think that's a major concern too. Um, and obviously we want to make sure that we do what we can to make sure those public health concerns are addressed. But I think in terms of what we can do as a country, get your vaccines.
Pertussis, though, I'm going to guess when you go into poorer countries around the world, it is much, much more common.
Yeah, definitely. Yeah, I mean, a lot of these diseases, that we have the luxury of not having to experience. I mean, there's still problems all around the world. I mean, and I know organizations like the World Health Organization, they try to get vaccines developed in other countries, but you have. I had the opportunity to live in the Philippines for a few years, and I'll tell you, diseases that you don't see in America, they're just rampant there. As far as
Sure.
infections and diseases that are easily caught and treated here, they're rampant, and so we're very blessed to live in a country like the U.S. And obviously we can't let our guard down. We can't say, well, we don't need to get vaccinated, because that's kind of when things start to go south as far as, like I referenced earlier, in Texas, the huge decline in vaccines was associated with a market increase in the amount of pertussis that we saw.
We have a caller with us. It's 8:53. You're listening, of course, to Better Health with Tripp Family Medicine on News Radio 1310 KLIX and newsradio1310.com. Jeremy Daly answering your questions. Caller, you're up next.
Yes, as far as people not getting their children vaccinated, all of my children are vaccinated. I think those people that go granola and decide they're not going to do that, I think they're depending upon everybody else's children getting vaccinated. They'll say, well, my kid never got sick. Well, of course not, because everybody else's kids were vaccinated. I think that's really kind of poor parenting on their part.
We get back to that odds and probability with that, don't we?
Yeah, and the herd immunity concept that people who aren't vaccinated benefit from the vaccines of those who do vaccinate their children. And the problem is, like I said, we've been fortunate enough in our country to not experience a lot of the major public health concerns as far as these transmissible diseases because of vaccines, and we've pioneered a lot of the vaccines and done really well at reducing these infectious diseases that in other countries have been debilitating. And yeah, there is a benefit for those who decide not to vaccinate their kids. And it's certainly something we always we respect patient autonomy. That's one of the biggest things in medical ethics we're taught
Sure.
from day one is, people choose not to vaccinate. People choose not to do preventative health care. People choose not to get treatment for cancer when they're diagnosed. And,
That's called liberty.
That's called liberty. I mean, in living in a country like we live in, that's one of the benefits, is that we can make those decisions. And, some people, they make them in an ill-informed manner, and some people feel like they're very informed when they make those decisions. So that's the I guess that's what I'll maintain as far as my perspective on those decisions.
We have time for one more caller. We'll squeeze the caller in. You've got to make it a quick one. Caller, go ahead. You're on the air with Jeremy Daly.
Morning, Bill. Hey, I got a question. I don't have children, but what are some of the risks associated with this vaccine? Another thing, the caller before said that people who don't get vaccinated are benefiting for those that do. Well, you know what? I've never had cancer. I do eat granola. I don't force it on someone else, and I take care of myself. I don't run to the doctor for everything, but I have to pay high premiums because a bunch of other lazy SOBs choose that they just want to sit on their couch and drink pop and fill their gut with pizza and then run to the doctor when they're sick. So I have to pay for everyone else who doesn't take care of their make wise decisions.
Jeremy?
So I think the question initially was, what's the risk of getting the vaccine? Is that right?
Uh,
Yes.
yeah.
Yeah, so I mean, in terms of getting the vaccine, the risk is, you can get local, redness, irritation, swelling, sometimes fever. Those are probably the most common side effects of any vaccine. Um, and you feel a little bit ill sometimes. People can. I mean, it's almost like an immune response that you'd have if you were ill. But that's as far as pertussis goes. Those are the main side effects. There's other vaccines that sometimes have a little bit more um, wide side effect profile, but
We've got about a minute to go, a little under a minute, for people who'd like to get in touch with you at the office. How do they go about doing that?
yeah. So definitely give us a call at 933-4400. We're located in front of the post office on Fillmore. We are accepting new patients. We want to let people know that we have a new female PA, Lauren Bostrom, in the office, and she's great. We're really glad to have her with us, and she's accepting new patients. And yeah, you can find us on Facebook, and we're pretty active on social media. We have somebody who takes care of that for us, Shalene, and she does a great job. And we're just happy to meet you. So come in and see us.
Wanted to say thank you to Jeremy Daly, and we will talk about another one of these things in the near future. This one got people fired up a little bit today. Hey, in the meantime, we're going to talk again in the next half hour. We're doing a follow-up. We're talking with the folks from National School Choice Week following 9 o'clock news from Fox on News Radio 1310, KLIX, and NewsRadio1310.com.